Caring for our health, the role of primary care in disease prevention. At the heart of primary care is the concept of preventative medicine, the belief that disease or disability should be avoided rather than treated. How to put this into practice is something which has to be considered by all general practitioners. On a purely economic basis, the benefits associated with preventative medicine are considerable. Firstly, resources for treatment are not required. In addition, the individual can continue working and contributing to the economy. Unfortunately, not all conditions can be prevented. Examples include infectious disease such as Salmonella, which can be acquired from contaminated food. However, conditions such as type 2 diabetes can be largely prevented. With a rapidly aging population in many developing countries, it is important that prevention should have a high priority in primary care. Three different aspects of prevention need to be taken into account by general practitioners when considering the services they deliver. Firstly, primary prevention is the promotion of health and the prevention of illness, which involves vaccination programs and efforts to ensure that a safe environment is provided for individuals. Lifestyle modification, providing advice and encouragement to patients on how to change to healthier behaviors. It's a tool to change this at an individual level. Smoking cessation clinics are a good example of this. At a community level, awareness campaigns can be used to heighten awareness. For example, putting up healthy eating poster. Secondary prevention is concerned with the early identification of disease and the provision of prompt treatment to minimize its damage. This can include running screening programs where tests for specific conditions are carried out on a regular basis. Tertiary prevention is about reducing the effect of disease and disability on the patient, which can involve minimizing the patient's suffering using appropriate analgesia, pain relief, or promoting self-management, the management of a condition by the patient themselves. A good example of this is with patients who have diabetes. GP can also use screening programs in which tests are carried out for a specific condition at regular intervals. Screening can deliver considerable benefits in minimizing the effect of disease. When used with profiling, that is, identifying patients likely to develop specific condition using data from patient records, it can be very cost effective. Early diagnosis when condition or disease are identified at an early stage can mean that disease are easier to treat and can be completely cured in some cases. Disease screened for include cervical cancer, breast cancer, and heart condition. However, screening is not suitable for all disease. Some tests can have high levels of false positive, result falsely indicating the presence of disease. Further testing may be required for confirmation, which can be upsetting for patients. Tests can also be expensive and may return few results if incidence rates for a disease are low. Care needs to be taken in deciding whether to set up a screening program for a specific disease. In the developed world, targeting three disease-linked behaviors could provide huge benefits in human and financial terms. The first of these is tobacco smoking, causing death through lung cancer and vascular disease, as well as chronic obstructive pulmonary disease. It is estimated that around 100 million deaths were directly attributable to tobacco smoking in the 21st century, and that by 2030, this will increase by another billion. Eating too many fatty and sugar foods and not exercising is one of the main causes of diabetes. According to WHO, diabetes is likely to be one of the most substantial threats to human health in the 21st century, with a projected financial cost of $192 billion by 2020 for the United States alone. If diagnosed early, it can be managed relatively easily. The final behavior is a reduction in alcohol abuse. Studies show that the misuse of alcohol can be responsible for up to 5% of hospital admissions and can impact significantly on heart disease, diabetes, and liver failure. The medical profession has been aware for a long time that population health is improved by prevention. With a rapidly aging population, it is important that a similar conclusion is reached by governments in developed world.